Hey everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today. We're here at the HIMSS 2024 conference checking out all the various innovation on the show floor. One of the coolest innovations at HIMSS this year is ambient clinical voice. We're excited to share a demo that we did with Nabla where they show off their ambient clinical voice solution. Check it out.
Hi everyone, we're here at Nabla booth in order to demo Nabla Copilot. This is an AI ambient solution, and so we are actually the most deployed solution in the market. And so you may wonder what is an AI ambient assistant. And so we'll get into this, but this is basically a technology that will actually listen to an encounter between a doctor and a patient, and will automatically, within 20 seconds, generate a structured medical note. And we are going to do a fake encounter with Dr. Hedley here, our Chief Medical Officer, and I'm here, Laurent Landowski, and I'm the Chief Product Officer at Nabla. And so this is easy. It can work on a desktop or on a mobile. And so we will just now enter this, and so Dr. Hedley will do the doctor, and we'll actually press start on the app, and we will do a fake encounter.
All right, Laurent, I've got my app here. I'm going to hit start, and we'll get started, okay?
Okay.
All right, nice to see you. What brings you to the office today?
You know what? I have terrible headaches for the last 2 to 3 days.
Okay. Can you tell me more about those headaches?
It's more in the front, and definitely stronger in the afternoon.
Okay. Yeah. Any other symptoms associated with that, like nausea or vomiting, bright lights bothering you, loud sounds bothering you?
No vomiting, but bright light definitely is bothering me, for sure.
Okay. And so is there anything that you think that makes the headaches worse?
So yeah, bright light for sure.
Mm-hmm.
And no, actually I took a little bit of Advil, and it actually helps to relieve the pain.
Okay.
But yeah, that's pretty it.
Okay. And anything else that you've done to try to help with your headache besides the Advil?
Not really. I mean, when I go to bed, then usually the next morning I don't have the headache anymore.
All right. So how are you sleeping overall?
I say I have a stressful job, so it's not perfect, right? It's probably just 6 hours of sleep.
Okay.
Yeah, but it's struggle to go to bed for sure.
Okay. And so it sounds like you've got all that stress going on as well.
Yeah, it's a very tiring event here. So
yeah.
And so yeah, we're on the floor, and so it takes a lot of it takes a toll on your body for sure.
Got it. And then what about headaches in the past? Is this new for you, or you've had these before?
It's pretty new.
Okay. And do you smoke?
I don't smoke.
Good. Do you drink alcohol at all?
A little bit, like every French people, right? A glass of wine maybe.
Okay.
And so yeah, a glass of wine every day.
Okay, so just 1 glass a day?
Yeah, 1 glass a day. Is it good?
Sometimes it is good for you to drink a little bit of wine. Just in moderation is what we talk about.
Yeah.
Good. And any drugs at all?
No
okay,
drugs.
Good. I'm glad to hear that. I'm going to skip the physical exam here, except to say that your neurologic exam, from what I can see, looks normal, so that's good. Okay. And any questions so far?
No.
Okay.
Not really.
Well, headaches is a very common type of problem. Almost everyone has headaches at one point or another. And most of the time it's nothing dangerous and nothing to be concerned about. I do hear that you don't have a lot of sleep that's going on, and you have a lot of stress going on too. So those are some contributing factors to the headache that you have. So in general, the recommendation to try to reduce headaches: get enough sleep, get enough exercise, reduce stress. And those are all good ways to try to help with your headaches.
And should I do a CT scan or something? Or
that's a really good question, because a lot of times we are curious about whether or not we need to do some radiologic study, whether it's a CT or MRI or anything else like that. But the thing is, most of the time, because if your neurologic exam is normal, we don't need to do anything like that at this point, because your headache's only been going on for the past 2 or 3 days. Usually with those things that I mentioned, and maybe sometimes things like Tylenol or ibuprofen, that can calm the headache down, and you'll be better before you know it.
Okay, cool. So anything that I need to order Any prescription? No?
Well, if you have ibuprofen already, you can certainly continue to take that.
Okay.
If you want a prescription for that, I can send a prescription for the food
How
as
much
well.
of ibuprofen should I take?
Yeah, you can take something like maybe around 600 milligrams 3 times a day.
Okay.
Take it with food.
Okay, cool. Thank you very much for seeing me.
Yeah, no, of course. If your headache doesn't get better, make sure you let us know, okay?
All right, sure.
All right.
Okay, thank you.
You're welcome.
All right, so that's the end of this fake encounter. And so Dr. Lee actually just click on end the encounter. And so now Nabla Copilot will actually trying to structure and summarize the conversation that we just had. And so the note will be generated on the phone, obviously, but also will be transferred to the desktop, because usually a physician, they actually document and chart on a desktop with a bigger monitor. So this is what is going to happen here in a few seconds. And yeah, it's very important. As you've seen here, the doctor is fully present and doesn't type anymore during the encounter, which really helps, with the patient as well. And so we got a lot of feedback from patients that actually notice a change and having, the doctor fully present during the encounter. And so what you can see here is that the note was generated on the phone. You can see here, and it's actually going to be also on the desktop. And so usually this is where the physician will review it very quickly because it's a draft note, and they will actually edit it. They can edit it through text. They can use their own voice in order to make some small edits. They can also use, the magic edits feature, which is a unique feature that we have that allow physician to actually regenerate a note with additional instruction. So if we were talking a lot about, a procedure or the risk of something, and the note was not enough details, you can actually ask Copilot to actually redo the notes with much more detail on this part, for instance. And so that's really something that is very important, because sometimes you wanted to fine-tune or customize the note to your readings. And so it's also important, I think, to realize that we do support like more than 50 plus specialties. Every specialty have their own way to do their clinical notes. Can be different sections, can be different things that you wanted to actually detect. So for instance, if you do mental health or behavioral health, you would probably wanted to get much more information about the social, the social life and some of the risk, the anxiety risk and so on. And so it's very important to actually capture that. So we do have in the settings of Nabla Copilot a way to actually customize, and you can even create your own template, note template that will capture specific part of the inclusion. This is very important because every physician have their own way to do their own notes. So you'd better have an ambient solution that can adapt to the physician. What we don't want is the physician to adapt to this technology, but this is the opposite. And the last thing that I want to add is usually so we had a small physical exam during this encounter. Usually the doctor will not verbalize everything. They will not say exactly what's going on in their head when they do a physical exam. And so we have a way to actually do these, what we call ambient dot phrases. This is like a shortcut. If the doctor says something very simple like your heart is fine, or I just checked your heart and it's perfectly fine, Copilot can actually detect this and automatically add into the notes a full, the full content of what actually they checked regarding the cardiovascular exam, whether there was murmur or not. And so a full list of everything that they checked, but they didn't verbalize because it will be weird to say exactly what you checked with the patient. And so that we call it ambient dot phrases, and this is something that is really, really beloved. And the last thing I think is, what is very important also is 85% of what's going on during an encounter is actually forgotten by the patient the minute they left the exam room. So in order to actually help here, we also generate what we call patient instructions, which are a way to actually generate an after-visit summary for the patient in patient-friendly terms so that the patient can actually get in the patient portal a summary of what happened. And they can just look back at this summary when they're back home and remember what was discussed and the plan and everything. And so this is something that our 30,000 physicians in our community and that use our product really loved, because it's really helped them to make sure their patients are connected and really are involved in the care. Dr. Edley, do you want to say anything else? Did I miss something?
Well, no, I don't think you missed anything, Laurent. And I use this myself in my daily practice whenever I see patients. And I have found that it's been really effective for me to be able to complete my documentation, which is one of the big burdens that I face whenever I see patients. I want to be able to spend time with my patients, taking care of my patients, and not have to enter information into the computer system. And so this allows me to spend my time focusing on what the patient is saying and to build that rapport with the patient that the patients deserve.
So I think that's a wrap up here. So thank you very much for watching this demo. Very happy to share the technology and the fact that we use. You can actually go on our website. It's super easy. It's free to test. You go on nabla.com and you can test Nabla Copilot by yourself and just test it and see how it fits with your workflow. And I'm pretty sure you will see like many or thousands of physicians that it's going to save from 1 to 2 hours a day. And you can get rid of all the pajama times that you spent documenting, at night. And so we're here to help, and hopefully our Nabla Copilot can help you, relieve the burden of the medical documentation. Thank you very much.